Good morning, good afternoon, and good evening. Hey guys, welcome back to the channel. My name is Omer, and I'm a doctor. My passion is to share valuable knowledge that can enhance and potentially save lives. My mission is to empower you with information that can make a real difference in the world. In this video, we will discuss everything you need to know about ulcerative colitis, including its causes, symptoms, treatment options, and much more. Before we dive in, it is important to have at least a very basic understanding of your gastrointestinal system. Think of your digestive system as a high-tech factory. Its job is to break down food into tiny particles and extract all the valuable nutrients your body needs to stay healthy. This incredible system includes a whole range of organs, from your mouth and esophagus to your stomach, small and large intestines, also known as the colon, rectum, and anus. Each part plays a unique role in keeping your body fueled and running smoothly. What is ulcerative colitis? Here is the literal meaning. Colitis means inflammation of the colon, whilst ulcerative means that ulcers can develop in the areas of inflammation. Ulcerative colitis is a chronic inflammatory bowel disease that affects the lining of the colon and rectum, together known as the large intestine. It is a type of inflammatory bowel disease, IBD, that causes inflammation and ulcers in the lining of the colon. The inflammation is usually continuous and begins at the rectum and extends to the entire colon. The combination of inflammation and ulcers in the large intestine usually cause bloody and slimy diarrhea. Ulcerative colitis is a chronic, relapsing condition. Chronic means you will have this disease for a long time and symptoms can relapse in what are called flare-ups. We will cover this in more detail a little later in the video. Proctitis. Now, let's talk about proctitis. This is a type of ulcerative colitis that's a bit of a lone wolf, as it only affects the rectum. But don't let that fool you. Proctitis can still pack a punch with symptoms like rectal bleeding, pain, and discharge. The good news is that there are treatment options available to help manage proctitis, from suppositories and enemas to more advanced medications and biologic therapies. We will talk about this later in the video, so stay tuned. Who develops ulcerative colitis? Globally, up to 500 out of 100,000 people develop this disease. It usually affects ages between 10 and 40. Surprisingly, non-smokers are more likely to develop ulcerative colitis. However, this does not mean you start or continue smoking because it causes many other diseases, so the risks greatly outweigh the potential benefit. Causes of ulcerative colitis. The cause of ulcerative colitis is not known, but it is believed to be an autoimmune disorder, which means that for some reason, the body's own immune system attacks the healthy cells in the large intestine, leading to inflammation and all of the unpleasant symptoms that come along with it. There are several factors that scientists and medical professionals believe can contribute to its development. It is thought that the most likely trigger for ulcerative colitis to develop is a bacteria or virus. However, it is not clear exactly which specific bacteria or virus. Genetics can play a role in whether or not someone develops ulcerative colitis. People with a family history of this condition are much more likely to experience it themselves. 1 in 5 people who develop this disease have a close relative with the same condition. So, while we don't have all the answers just yet, it's clear that there are many different potential factors that can contribute to the development of ulcerative colitis. But don't worry, we'll be discussing treatment options in the upcoming section, so stay tuned. Symptoms. The symptoms of ulcerative colitis vary from person to person and depend on the severity of the disease. Common symptoms include diarrhea, which is usually mixed with blood and mucus or pus, abdominal pain and cramps, pain when passing stool, urgency to have a bowel movement, a feeling of wanting to go to the toilet but with nothing to pass. People generally feel unwell during a flare-up. It is common to also experience fatigue, fever, and loss of appetite, feeling sick, weight loss. When a relapse or flare-up of ulcerative colitis hits, it's like a storm brewing in your gut. The inflammation in the colon and rectum become more active, and your body starts to send out warning signals in the form of symptoms. These can range from mild discomfort to more severe issues like rectal bleeding, fever, and dehydration. Mild flare-ups may cause just a few loose stools and a little tummy trouble, while moderate ones can bring more frequent bathroom trips, abdominal pain, and fever. Severe flare-ups, on the other hand, can cause significant abdominal pain, a high fever, and even lead to dehydration and a large amount of blood in the stool. It is always important to seek medical advice if you think you are having a flare-up. Diagnosis. Initially, your doctor is likely to perform a stool test called fecal calprotectin along with blood tests. If the results are suspicious of inflammatory bowel disease, IBD, such as ulcerative colitis, then further tests are arranged. These include camera tests called sigmoidoscopy and colonoscopy. These are the gold standard tests as they allow the doctor to look inside directly at the lining of the colon and rectum by passing a special telescope through the back passage. Small samples known as biopsies are taken, which are then looked at under a microscope to confirm the diagnosis. Treatment options. The treatment for ulcerative colitis depends on the severity of the disease and the extent of the inflammation. The goal of treatment is to control the inflammation, relieve the symptoms, and prevent complications. Treatment options include medications, lifestyle changes, surgery. Let's talk about these in more detail. Medications to treat flare-ups of ulcerative colitis. Medications are a crucial part of managing the symptoms of ulcerative colitis. Each time there is a flare-up, a course of medication is required to help treat this. The medication advised will depend on which area of the large intestine is affected by ulcerative colitis and the severity of the flare-up. Aminosalicylates, for example, mesalamine, sulfasalazine, oxalizine, and balsalazide, are a type of anti-inflammatory medication that can be used to treat mild to moderate cases of ulcerative colitis. They work by reducing inflammation in the colon and rectum. These can be taken orally or given as a suppository or enema if the rectum or lower part of the bowel is affected. If aminosalicylates are not working or the flare-up is more severe, then some people may need to switch to steroid medication, which can also be given orally or rectally, as an enema or suppository. Steroids such as prednisolone are typically used for short periods of time to treat flare-ups, as they can have significant side effects if used long-term. Immunomodulators are medications that work by suppressing the immune system, which can help reduce inflammation in the colon and prevent flare-ups. They are typically used in more severe cases of ulcerative colitis if the symptoms persist despite using the medication mentioned earlier. Some common immunomodulators include azathioprine, mercaptopurine, and methotrexate. Biologics are a newer class of medications that target specific components of the immune system that contribute to inflammation. They are typically used in more severe cases of ulcerative colitis and can be given via injection or infusion. Some common biologics used to treat ulcerative colitis include infliximab, adalimumab, and vedolizumab. It's important to talk to your doctor about what medications might be right for you, as different medications can have different side effects and risks. Your doctor will take into account the severity of your disease, the location of the inflammation, and other individual factors when making a recommendation. Medications to help prevent flare-ups. To reduce the chances of a flare-up, aminosalicylate medicine such as mesalazine, mentioned earlier, is most commonly used to prevent and reduce the chances of flare-ups. You may need to take this medication indefinitely to prevent flare-ups. Most people tolerate the medication quite well without side effects. Lifestyle changes and other general treatment measures. In addition to medication, lifestyle changes can also help manage the symptoms of ulcerative colitis. A special diet is not usually needed as long as it is generally healthy and balanced. Drinking plenty of fluids and avoiding caffeine and alcohol can also help. Regular exercise and stress management techniques, such as yoga and meditation, may also help reduce the symptoms of ulcerative colitis. Multivitamins including iron, vitamin B, and folic acid are recommended. Probiotics are supplements that contain good bacteria, which is healthy for the gut. These bacteria can help reduce the bad bacteria and hence reduce the chances of a flare-up. Further research is still required to clarify the specific role of probiotics. Who needs surgery? At what stage is it considered? Surgery may be considered as a treatment option for people with ulcerative colitis who do not respond to medication or who have severe or life-threatening complications. It is usually considered when all other treatments have failed, and the symptoms of ulcerative colitis are significantly impacting a person's quality of life. Surgery may involve removing the entire colon in a procedure called a colectomy, and can sometimes be done in 2 stages. During the first stage, the colon is removed, and a temporary ileostomy is created. The ileostomy is a surgical opening in the abdominal wall that allows waste to exit the body and be collected in a bag outside of the body. During the second stage, the ileostomy is closed, and the small intestine is connected to the rectum, allowing waste to exit the body in the usual way, so there is no need for an external pouch. In some cases, a proctocolectomy may be done, which involves removing both the colon and rectum, in other words, the large intestine, and leaving the anus intact. The small intestine can be attached to the anus, allowing waste to exit the body in the usual way, so there is no need for an external pouch. This procedure may be an option for people who have inflammation affecting both the colon and rectum. If surgery is something that is required, your healthcare professional will be able to discuss this in much more detail with you and answer all of your questions. Complications. Here are some potential complications of ulcerative colitis. Toxic megacolon. This is uncommon, however, is a serious situation. It occurs when the whole of the large intestine becomes ulcerated, inflamed, and dilated. This can rupture or cause severe bleeding. Urgent life-saving surgery would be required if this does not respond to medication. Colon cancer. A small proportion of people with ulcerative colitis are at an increased risk of developing colon cancer, especially if the disease has been present for many years or affects a large portion of the colon. Malnutrition. Ulcerative colitis can interfere with the body's ability to absorb nutrients from food, which can lead to malnutrition and other related health problems. Hence why extra supplements or vitamins are recommended. Perforation of the colon. In rare cases, the inflammation caused by ulcerative colitis can cause a hole or perforation in the wall of the colon. This can lead to a serious infection and requires immediate medical attention. Blood clots. People with ulcerative colitis are at an increased risk of developing blood clots, especially if they have severe inflammation or are bedridden for long periods of time. Anemia. Ulcerative colitis can cause chronic blood loss, which can lead to anemia, a low red blood cell count. Anemia can cause fatigue, weakness, and other related symptoms. Please see my video on anemia if you would like to learn more about this. Arthritis. Some people with ulcerative colitis may develop arthritis or other related joint problems, especially during a flare-up. Eye problems. In rare cases, ulcerative colitis can cause inflammation in the eyes, which can lead to redness, pain, and vision problems. It's important to work closely with your doctor to manage your ulcerative colitis and prevent complications. Regular checkups, colonoscopies, and other tests can help detect any potential problems early on. If you experience any new symptoms or complications, it's important to notify your doctor right away. Prognosis. The prognosis for ulcerative colitis varies from person to person and depends on the severity of the disease and the effectiveness of the treatment. While there is no cure for ulcerative colitis, there are effective treatments available that can help manage the symptoms and prevent complications so you can carry on with life as normal. A severe flare-up can be life-threatening and needs urgent medical attention. Taking regular medication advised by your specialist will reduce the chances of flare-ups occurring. In severe cases, surgery may be necessary to remove the colon and rectum. Treatment for ulcerative colitis is continuously being researched, so a new breakthrough may be just around the corner. And that's it, guys. I tried to make ulcerative colitis super simple for you. My wish is that this information will be a helpful resource for either you or someone you love. As a full-time doctor, my goal with this channel is to share my medical knowledge with all of you to help improve your overall health and well-being. If you found this video useful, please consider subscribing for more helpful content just like this. I'll be publishing a new video every week, so if you have any suggestions for future topics, please leave a comment below. Until then, take care of yourselves and stay healthy.